I'm here to learn. I'm here to commit ourselves. That's all.
We have some.
Can we do
Yes, please.
the
Thank
PowerPoint
you.
mode?
Thank you for your patience. Thank you. Quiet, please.
So it's indeed a privilege to listen to committed people like Nilesh ji, Dr. Sunil, Rajesh ji, Lalita ji, and all of you who are doing such work which is changing the lives of so many people. So hats off to all of you, salute to all of you. We are here to learn, and Dr. Rajesh, in fact, my first exposure to organ transplantation was when I lost my mother in the month of March this year itself, and my siblings, my parents, they are in Surat only. So there I got to know that very vibrant community is there, and her eyes were donated and 2 people are able to see. We feel so happy, so overwhelmed. It's a great feeling. So that was my first exposure, and then Dr. Rajesh, he invited me. I said I've done nothing in organ transplantation, but he said that certain other projects we have done in Haryana, maybe there are learnings from them, which made me think, and I have made a small presentation. Here we are trying to see what are the levers which are common for large-scale impact programs. So this is based on learning from Haryana. So these are the 4 projects in which briefly I mentioned about Beti Bachao, Beti Padhao in the morning. Second one is Saksham Haryana. I'll very briefly explain. And the common threads, it's a little digression, perhaps relevant. Dr. Rajesh thinks so. He's a professor, so you have to believe me. So second is Saksham Haryana. Third is Antodaya Saral for public service delivery for services and schemes. Fourth one, we have a program called Chief Minister's Good Governance Associates. And then we are going to discuss the various levers which are perhaps important for large-scale transformation or bringing impact on ground, basically changing the lives of many people. So first was Beti Bachao, Beti Padhao. Haryana was really infamous even at the international level. So it was a huge challenge. 2001 census, we were number 3 from the bottom. 2011 census, we were the worst in the country. And then Honorable Prime Minister, he chose Haryana to launch this Beti Bachao, Beti Padhao program from Panipat. Perhaps it's the 4th battle of Panipat. So it was really a Herculean task, and it seemed that the Honorable Prime Minister has challenged the state leadership, and then the state leadership, they owned up the challenge. We have a small secretariat since May 2015. Dr. Singhal is here. He works full time to sort of take care of this program. So the main objective of this program was to save girls. In thousands, we have been able to save. So there were various strategies. I'm not going to into details of that, but primarily it was Chief Minister office reviewing from top, then district magistrates reviewing at the district level and providing the necessary leadership. Apart from that, all the monitoring tools like having regular video conferencing with the district collectors, district level monitoring, crack down on sex selection drugs, crack down on illegal ultrasound centers, illegal sex selection or illegal abortion. So all these things, enforcement, and plus lots of IC activities, which I'm not covering in my presentation today. So all these things were done over a period of time. And I'm so very happy to share, we started from a level of sex ratio of 871 girls against 1,000 boys. So very rapidly we were able to change this scenario, and we are so very happy and proud to share this year till October 2019 our sex ratio at birth is 920. Sometimes sex ratio at birth, these are numbers, but the important point is we have been able to save around 21,000 in state of Haryana, which was so very infamous for killing the daughters in wombs. So we have got multiple awards, international awards. We have been published in Wall Street Journal, India Today, lots of publication, online also, lots of credit because Haryana was really infamous. Second one is to turn around the citizen service delivery system in the state of Haryana. Antodaya is how do we reach to the last person standing in the queue. SARL is basically to indicate the service delivery, G2C, government to citizen service delivery. So, very briefly, one part is on the left hand side is the online platform. So we have an online platform, we call it Antyodaya SARL platform, in which 500 schemes and services from 37 different departments, they have been brought to a single online platform. This helps a lot. This gives the leadership scores. This makes the monitoring possible. Say a citizen goes for a license to an authority. Will it be implemented? Will he get the work done in the time prescribed as per the Right to Service Act? So these are the things which we monitor very closely. We are able to do so because there is an online system. Second is the citizen touchpoints. Not everyone can go to website or a mobile app to get the services or schemes. People actually will come to on-site centers, the physical touchpoints. So here we have been able to create 115 physical touchpoints at district, subdivision and tehsil level, where standardized processes are there and we are able to give best of facilities. Like when we go to visa facilitation center, the kind of standardized facilities we are able to make, and the vision is that the citizen is not required to go to the concerned department to take the services of that department. That was the vision. So these many numbers for almost 500 scheme services on this. Every month we receive 4 lakh plus applications on a single platform. 6 lakh plus SMS are sent to citizens every month, month after month, at all stages of service delivery, like Amazon, Flipkart, the citizen can track, and proactive SMS is also sent. And then we have a helpline number, so 70,000 plus calls we receive every month. And if there is a grievance, ticket is generated and we try to resolve those grievances. So these are numbers, and we take average citizen feedback score for this is 4.3 on a scale of 5. So we take the citizens' feedback very, very seriously. So multiple awards, it has been appreciated all over, and we are able to provide best-in-class experience to the citizens. Third one is about the transformation of school education system. So here we are talking about the education system in 15,000 odd government schools of Haryana. So this Saksham is basically to make the child Saksham capable, or so here it's a huge system. We can understand how big the system is. But then the important thing was when we started this campaign in 2017, the idea was to bring our kids to their grade level competence. Of course, we wanted 100%. At that time, we were around 55%. We wanted to make it 80% in 2.5 years. So this was the kind of objective when we started. So these are the various cycles. We started in 2014, 2017 to 19. This wave is called as Saksham Haryana. Now we are in Saksham 2.0, where we have become much more ambitious. And this is the Saksham Chakra. Here we have taken the systemic approach to do this, because at times we lose the sight of the entire system which is there. Maybe we choose the wrong KPIs, or maybe we are making one intervention which is helping solve one problem, but maybe other problems are being created. So we take a very systemic approach to do this. Major success story it has become, much beyond perhaps our imagination also. 86% students, they were graded as grade level competent by the year 2019. We are talking about class 3, 5, 7 in 2 subjects only, Hindi and mathematics. We wanted to start small so that we are able to demonstrate success, and now we are scaling it up. So Niti Aayog is appreciating all over national media. We are there, even India Today covered this story. So we have been able to create a mark. This is Chief Minister's Good Governance Associate Program, one of its kind in the entire country. Here it was the foresight of Honorable Chief Minister. For this program, Ashoka University, that is in Sonipat, bordering Delhi on the northern side. So this is a program in which we take youngsters, high caliber individuals coming from best of backgrounds. They are really, really charged up and very, very motivated. They come from diverse background, but they work with Chief Minister's office plus the district collectors. They are given certain projects, and some flexibility is also there for them to choose their areas of interest. So they typically do flagship programs, then innovative ideas they can work on, they ideate also, they give different kinds of solution, and then they provide feedback to the Chief Minister's office and then to the district magistrate also. So this year, the fourth cohort is right now working in the field. We bring them in only for 1 year and the next batch comes. Property tax, they are working on higher education, women's safety, e-office, Swachh Sarvekshan, in addition to Saksham Haryana or Untitled Chapter. So these are youngsters. They typically meet Honorable Chief Ministers after every 2 months. So what are the common levers which we realized are important for any large-scale impact programs, or maybe these are the learnings we are going to take it to the organ donation and transplantation strategy, which I briefly shared. This we wrote only in 3-4 days, but the basic contours were there, and of course after learning from all of you, we can definitely take it forward. So first one is, what are the levers? What are the leadership lessons for any large-scale impact programs? So first one is shared vision. Shared vision is very, very important. So Beti Bachao, saving the girl child, we should be able to save the lives of all children, all girls who are killed in wombs. Second is transparency, efficiency in service delivery. Very, very specific. I'm giving only small phrases, but we know what exactly we are trying to do. And the Saksham Haryana to improve learning outcomes so that we provide meaningful education to our children going to the government schools. And promoting good governance is the overarching shared vision for the CMGG program. So when we say to improve learning outcomes, so shared vision is between the Chief Minister's office, then the department, school education department, district magistrates, the entire district administration, the school education department, panchayats, municipal councillors, parents, and the students also eventually. So students also know that they have become Saksham now. So, and they describe how they have become Saksham. So this kind of shared vision is very, very important. Each and every life is important. So if we talk about organ donation, so of course this is the shared vision that people should not die because of lack of donated organs. So this is the shared vision, which of course after a week or so when we launch this program in Haryana in a big way, then this will be sort of discussed with stakeholders. It's very important to understand what they think about it, and slowly we are going to build up with all concerned. Second is systemic approach. Systemic approach is very, very important. Left hand side, the same thing. The Saksham Chakra for the competencies. Let's not go into detail, but we should understand the various parts of the system, how one intervention is going to affect the entire system. So this systemic approach we are taking in Saksham Haryana. That's why, systemic approach helps because the results come very quickly, rather than experimenting. Of course, once, if we are not knowing how to do it, then of course you have to learn. But if we know, RCT is not required here. RCT is required when we don't know what works. Second is for the Untitled Chapter. The simple point is that the citizen should not go to the departmental office. So this was the shared vision. Why should a citizen go and meet the concerned license clerk or the registration clerk? We understand what happens if the citizen goes and meet the concerned clerk. So money is going to exchange, and in fact that creates problem for the staff also. So this kind of shared vision, the systemic approach I'm talking about. So here also a systemic approach will be more clear when we start working, but the idea is that the interrelationship, the convergence, all becomes very, very important when we talk about organ donation and transplantation. Third is use of technology and data. So here the important thing is to create data sources. Many districts can be ranked on an ongoing basis, daily basis. So this is very important. On the left hand side we see Saksham Plus assessment dashboard. So we have lots of data coming about students, teachers, their monthly assessments, all kind of data, and about the academic monitoring system also, which gives us a clear picture. For the CMGG module, we have module trackers, so it's important that we use technology and get data in real time so that we can take decisions. So similarly here, when we talk about organ donation and transplantation, our thinking so far, whatever we could think of. So here, so many things are happening. Brain death certification, then organ retrieval at the approved centers, organ transplant approval, and then hospitals with organ-wise requirement, medical colleges with organ-wise requirement. So all these systems, they have to come together. So it's very important to create and of course, some of it would be there, we have to understand it clearly, but the thing is that if we have a registry, if we have data sharing possible through online means, then it becomes transparent and it helps a lot in making the difference. Next one is gamification, very, very important, because in government system, many times we are not able to give them monetary incentives, which are possible in private sector. So what do? We do give non-monetary incentives, and most of the time, these incentives can be free of cost. For example, in Saral, we have district scores, we give leadership scores, and we give, say, officer of the week, officer of the month, those kinds of things. Saksham district dashboard. So on the basis of various KPIs, we come up with composite scores. All this helps a lot. So what we have realized during last 4 to 5 years is, if we use lots of colors, green, yellow, red, this really helps. So when we do the VCs or the monitoring meetings or reviews, the people whom we are talking about, districts or sub-district level, if the colors are red, they really get concerned and they want to make it yellow and then green. So sort of competitiveness and then little gamification is there so that people are actually feeling motivated about it. And of course, we normally don't believe in giving punishments. We rather sort of create a mechanism. So here maybe there could be competition in terms of between hospitals, between districts about the organs retrieved, organs transplanted, number of lives saved. Very basic, very rudimentary, but of course a lot of work will go into it, and we will be able to come up with the, of course, taking your help with the right kind of composite indicators. Taking people along, very, very important. It's a fairly complex project. This I realized since morning after hearing from many of you. It's a very, very complicated project. The supply chain is important. Time is a limitation. So how do we take everyone along? So it's important that we give them awards. Of course, to the right people, it's very, very important. And then giving them certificates or having activities which bring people together, because bringing people together, and I think this is one great forum where Mohan Foundation and IIM Ahmedabad, they have come forward to invite all of you from all over the country. This really helps when people meet and learn from each other. So here, of course, we are proposing that Hospital of the Month, awards to transplant coordinators in Haryana, Best Performing District of the Month. These could be the various kinds of awards or recognition which is going to help and taking our people along with us. Last is very, very robust review and monitoring system, which becomes important to take the project forward. And one of the slide we can see Honorable Chief Minister taking review of all the deputy commissioners and SPs for some of our programs, and then CM office taking the review of head of the departments, departmental reviews, and maybe reviews by the deputy commissioner. All this is, of course, very, very relevant for this particular project also, because one is data collection, second is reviews based on the robust data which we collect. Chief Minister Good Governance Associates, I said briefly in the beginning, they are very, very important for this project, and they have been part of very, very successful projects in Haryana. And these are people who bind everyone together. So they are the people, if no one is working, like for example, we start in Rohtak. If we have a feeling that the college or the district administration, police, they are not coming forward, at least one person will have there, the Chief Minister Good Governance Associate in Rohtak, who will be really interested or who will be driving force. Till the time no one is there, he will be the soldier who would be there to sort of take this agenda forward. So I'm sure this instrument will be helpful in this project like in many other projects. So these are the various levers which we believe that are important for driving and making large-scale impact. Topic could be anything. The importance is if the intentions are right, if the methods are right, we are definitely going to make difference. Any questions? Yes, please. Yeah.
So you said physical touch points. The people need not go to a service center. Then how do they approach?
So there are two things. One is through internet, that is the web portal we have, Untitled Chapter, or mobile app. These are the online platforms through which they can do. And second is physical touch points. Physical touch points doesn't mean that they have to go to the concerned officer or the concerned office. They will come to the facilitation center, citizen facilitation center. These centers we call as Antodaya Saral Kendras or Saral Kendras. These are typically at the district level, subdivision level and tehsil level. The beauty is that the operators will be from, say, district IT society, but not from the concerned food and supplies department or licensing authorities. You understand? So there will be no direct interface between the citizen and the department concerned, because that breeds corruption, that creates confusion. So, yeah. Thank you. Yes, please.
So nowadays, hospitals are already competing against each other in terms of numbers and margins. And when you talk about gamification and if you look to make this official government policy, don't you think that will lead to an increase in unethical practices?
You know, this point I have understood while talking to one of the colleagues here. The important thing is what we are talking about. Right now, the struggle is to do the retrieval part. Okay, doing the declaration of brain dead person. So here, I am told very, very clearly by Dr. Rajesh and many, many others that the doctors, they are not interested in doing this job. You understand? Of course, they have to do more paperwork if they have to declare the person as brain dead. You understand? So if we have a competition between hospitals, if retrieval is more, this is something which is going to help. You understand? So here the conflict of interest is as such not there. There may be conflict towards the actually transplantation part, but there we are going to manage in terms of seniority, in terms of we are going to be very, very transparent in giving the organs. Any other question? Okay. Thank you so much. Thank you.